sure that you have your setup. And you should all have the setup either in your operatory. Do you have any of these supplies in your operatory? I guess the instruments you would in your stations. And then we have sealants material in the common area that are available to you. So you want to have your mirror, Explorer, cotton forceps, articulating paper, 4 steps, polisher. One thing that's missing on here that I don't see is the pumice, a little bit of pumice. Etchant, sealant material, high-speed evacuator tip, cotton rolls, and also triangles if you're working on a patient, and floss. This dab and dish here is probably ready for the pumice, I would say. Okay, and then your patient and you both need to have safety glasses, and then this protective shield. Do you have a shield that's automatically on the light in your clinic, or do you have glasses that you use? It's on there already? Okay, great. So in some dental offices, they may have these older types of lights, and so if you don't have the shield on there, just ask, and they should have this one that you can use, okay? Now, the biggest tip I can give you again, it's lakes or rivers over lakes, right? We don't want lakes, we want rivers. So you don't want to overfill the sealant. Okay, just another review of the setup. And this is the procedure. So you're going to go ahead and clean the tooth with the pumice, and then dry really well, isolate the area, apply etchant for about 20 seconds. Usually I replace the cotton rolls after I rinse the tooth because, you know what, as you're rinsing, you're going to get them wet anyway, and you may get some etchant on there. So I replace the cotton rolls at that point, and then dry the tooth really well. And I'm not sure if on your typodonts, if you can see that decalcification or the demineralization after the etchant. On patients, when you work on patients, it's going to look chalky white. So as you dry it, it's going to look chalky white. And so that means that it's etched sufficiently and you can proceed with the procedure. As you're applying the etchant, the sealant, as you're applying the sealant, just place a little bit of it in the grooves. And then I usually use an Explorer to guide the sealant material into all of the little pits and areas of the groove that I may not have gotten to with the applicator. What I also do is if I see that the patient, like in this case, has a lingual groove that is deep and if there's no decay in there, I go ahead and guide that sealant into that groove, okay, and seal that as well. Now, before you do anything as far as sealants, you always want to double check with the dentist that it's okay to seal the tooth. And usually you want to have bite wings, recent bite wings on file so that the doctor can make sure that there's no decay before you go ahead and place the sealant on there. Then you're going to light cure for 20 seconds. Sometimes I add to it a little bit, especially if I'm on the distal of the upper molar all the way in the back. I just like to give it a little extra light. And then, then you want to go back in and check with the Explorer to make sure that the sealant stays. Like I said before, it's sometimes difficult to keep those distal pits of the terminal molars dry. So sometimes you can actually see some sealant that's come off. So if that happens, you just want to go ahead and suction all the moisture out, dry it really well again, and try and reapply it. Just put a little drop of the sealant back in there. And then you want to use your floss to check the interproximal areas to make sure that there isn't any sealant in there. 2 weeks ago, I had a patient, and their tooth was chipped. So when I was applying the sealant, some of it flowed in between the teeth. And when I was trying to get it out, sometimes it's a little hard to get that sealant out from the contact. I actually used floss and a floss threader and went under that contact, and I pulled up a little bit and helped loosen that sealant that was in between the teeth. And it was, it came off that way, so it was good. And then, lastly, you want to check your occlusion to make sure that the patient isn't biting too high. And if we have a high spot, then it can be adjusted with a low speed handpiece and a burr or a disc. Okay? So, that's the procedure. then to talk a little bit about different types of sealants, I would say that most offices that I went to use light cured sealants, which are probably the sealants that you have here, right? You don't have any of the self-cured here. The self-cured, the only time that I used a self-cured sealant, it's a sealant that has two parts to it that have to be mixed, like the triage, which is used in St. Louis actually during Give Kids a Smile. And the reason why they use that one is because it is very forgiving as far as moisture. They actually encourage that you have some moisture on the tooth with that sealant. And the way that the sealant is manufactured nowadays, the two-part system, is they put it into a capsule. And you know what I'm talking about, right? When you're using your amalgamator, your trituration, that's the type of capsule that the sealant comes in. So you would triturate it. It mixes the two parts together, and then there's this gun. It's like a stainless steel gun that you put the capsule in, and then it has a little tip at the end, and you squirt out the sealant that way. And one capsule is good for all the teeth in the mouth. And usually with the Give Kids a Smile, we would do, I don't know, 4 to 8 teeth with this one capsule. And you just go in and just very easily just go in real quick. You want to evacuate if there's a lot of saliva, you want to get that out, but you actually want the area wet. And you just put in the sealant in all of the areas, and then you use your finger and you just kind of push it in a little bit and get the excess off. And then it self-cures, okay? So that actually is a pretty good system for Give Kids a Smile. But I have not seen it in private offices. Maybe there are offices that use it out there. I'm not sure about your clinic here that you're going to be assisting at. For the self-cured sealant, it usually takes about 2 minutes for it to set up, okay? So the one nice thing is that it is forgiving as far as moisture. Okay, so fluoride varnish, we're going to go over that a little bit. How many of you had a varnish applied to their teeth? Okay, so not too many, so tomorrow's the day. You will get to experience the varnish. I love the fluoride varnish. It's a very effective way of delivering fluoride. The fluoride uptake is very good with fluoride varnishes. The foam, the fluoride foam is fine too, except that with the tray, sometimes, you know, depending on the manufacturer's instructions, but you have to have the patient sit there for about 4 minutes, okay? So when you're applying that to 8-year-old's teeth or 5-year-old's teeth, a lot of times they don't have that patience and, you know, to sit there. And also saliva is an issue sometimes with that too, you know, if they're sitting there for 4 minutes. So that's why I like the varnish, because it's quick and easy. So what you're going to do is first you want to assemble your materials for the varnish. And usually you're going to have a mirror, an explorer. You're going to have some 2x2, something to wipe the teeth off with in case the tooth has some food on it that you need to get off, like on the buccal, or, you know, a lot of plaque. Plaque is really not in the way for fluoride varnish. The varnish does make it through to the tooth. But if you have excessive food or excessive plaque on there, I would either have the child maybe go brush their teeth or just use some gauze to wipe the teeth, okay? And then you want your, you know, mirror and your varnish ready, and I think that's it. Of course, your protective eyewear and protective eyewear for the patient. Usually the varnish is 5% sodium fluoride, okay? And there are different flavors out there right now in our office. The popular one is raspberry, so we have raspberry. And of course, you know, your patient napkin and saliva ejector, okay? You're going to go ahead and seat your patient in an upright position just to explain the procedure to them. If the patient is, you know, younger than 18 years of age, I believe, you have to get a consent from the parent. So usually in dental offices, in our office, we just apply varnish to, you know, 16-year-old patients or younger, okay? So you will inform the patient of the treatment, get the consent, and then you're going to go ahead and review the patient's health history as well. So that's the first thing. You're going to wash your hands and then get started with the treatment. So you have your PPEs on, the patient's ready, everything's ready, and you can lean the patient back in a supine position, and you can apply the varnish. You're going to peel off the protective cover. Let me see if I can turn on the camera so we can see this on the monitor. you have a little bit different varnish here. This one is already ready for you. So when you pull the brush out, after you pull the brush out, you can just peel the cover off. There you go. And then you usually want to mix the varnish. It kind of separates a little bit. So before you apply it to the teeth, you're going to mix it very well for a few seconds. I don't want to get it all over the Typodon, so I'm not going to do that. But after you mix it, and what you can do in clinic tomorrow is have your assistant do it for you. Okay, you're going to have an assistant there so they can mix it for you, or they can peel the cover off and then hold it like this for you, and you can mix it yourself. And then you're just going to very quickly apply the varnish on all of the surfaces of the teeth. So all the buccals, linguals, and then occlusal surfaces. You're going to have to re-dip the brush every once in a while. You probably have to dip it, you're going to have to dip it about twice for the upper arch or 3 times. Okay, so a thin coating of the varnish everywhere, okay? Now, if the patient builds up excessive saliva, what you can do is, midway through the procedure, you can go ahead and have your assistant use the saliva ejector and just suction out the excess saliva. Okay, but you're going to work quickly, and the patient should be done in a few minutes. And once you're done, you want to sit the patient up and give them post-operative instructions with the varnish. They are no brushing or flossing for 1 evening, okay? We want the varnish to sit on the teeth for about 6 to 8 hours after the application. So I always tell the kids, you know what, you don't have to brush tonight. So that's the only time, or 2 times in a year, that they don't have to brush. And then I tell them tomorrow morning, you'll be able to brush it out. Because it does feel a little sticky, when you bite together, it just feels, your teeth feel a little sticky. So I tell them, I tell the kids, yeah, I know your teeth feel kind of strange right now, a little bit sticky, but that's, the varnish working and your teeth will be healthier, and just don't brush until tomorrow. So they're usually good with that, okay? And then you want to record, notes in your services. So make sure you write everything down, health history reviewed, and patient came in to have varnish applied, sodium, 5% sodium varnish. Yes?
How soon can they eat after?
They can eat it actually right away. I usually just tell them not to eat like nacho chips, for example, something really crunchy. But they can, if they want to go with their mom and 10 minutes later have an ice cream cone, and a drink, that's okay. I just don't want them to brush or to eat something like with sharp edges right away. But they're fine like 15 minutes later.
What about alcohol? Is alcohol effective?
Oh, I don't know. I don't think so. I'm not sure. That's a good
Like if you were
question.
drinking like shots at the
That's a
cue
good
or
question. Yeah, I don't know. That's something I need to investigate. Because sometimes you do have adults where you apply varnish, on adults. So varnish is pretty straightforward, right? Varnish is pretty straightforward. Other question? Any other questions? Okay.
We'll research that this weekend.
Oh, okay, let me send you an email. I won't see you guys until hopefully in August, so send it to me if you find some information on it. Okay, so I think we went over everything. This is just, these are some pictures of the procedure itself. Okay, and we went over all of the steps. Okay, fluoride tray application. I know, I think, have you guys done this already or not yet? But the procedure is pretty simple on the fluoride tray application. In station one, that will be, I believe that's going to be the wet lab. You will have different tables set up, different areas set up. There will be 4 different areas. The first one will be application of fluoride foam on the Typodon. So I just basically want you to see the different sizes of the trays that are available out there.